Good afternoon and welcome, Realtor family. It's great to be back with you for this Kentucky Realtor Town Hall. Your PAG has wanted to make sure that we continue to do all to understand how this change in coronavirus, COVID-19, affects you, your family, and your clients as well. After many calls from brokers and realtors, I'm here to encourage each one of you to continue to do your part, protecting our clients and our industry. My part today is to, again, turn on the red light, to encourage realtors, each of us, to do all that we can to follow the guidelines and recommendations set forth by the CDC and our lawmakers, as well as public health officials. Remember, at all times, realtors have to take the higher road. Our politics are not important in this battle against COVID-19, but our lives and those around us are. Governor Beshear declared us real estate an essential business. We continue to get updates during this pandemic. Unfortunately, our numbers have continued to rise across the state, but we have to do our part as realtors to control this COVID-19 because to whom much is given, much is required, meaning that it remains important for both brokers and realtors to do the simple things at a minimum as we attempt to walk through this virus. So I ask you, are you? This sounds so simple. Washing your hands frequently with soap and water. Are you using hand sanitizers? Avoiding touching your eyes and nose with unwashed hands. Practicing social distance, 6 feet apart, but avoiding large groups and gathering. Masking when you're around others. Staying home if you're sick. Get someone else to show for you if you're not feeling well. Clean and disinfect frequently touched items. Are we encouraging buyers to narrow their searches through technology first before we actually, and making sure they're pre-qualified before we started to show? Limit in-person showings to those that you know are serious. Discussing with sellers the precautions that you're taking to protect them and their families as well. And making sure we adhere to those things ourselves. Are we arriving early to make sure that all the doors, cabinets, lights are on before you start your showings? Are we requiring masks and gloves at all showings for our clients? Making sure that we carry masks if they don't have them, and wipes to all the showings so we can wipe down any touched surfaces. And if you're doing open houses or any showings, make sure that proper social distancing happens at all times. These are the number one type calls that we get. People in large numbers at open houses without masks and not social distances. We have a responsibility to lead and to teach and protect our clients. As COVID-19 continues to rage, we wanted to have health professionals to help us understand what this coronavirus looked like from healthcare providers that took calls from the very beginning. And that person, that first person is Rachel Alexander. She's a nurse practitioner with Norton Healthcare, and she's the director of Norton eCare, a virtual medicine and telemedicine service where people were truly fearful and afraid, but telemedicine played and continues to play an important part. So thank you so much, Rachel. Next, we have Dr. Swannie Jett. Dr. Jett is a health commissioner responsible for overseeing the health and well-being and the preventative practices for the community of Brookline, Mass. Previously, Dr. Jett was health officer and CEO of Florida Department of Health in Seminole County, and as well as Bullitt County here in Kentucky. A former executive director for Metro Louisville Department of Public Health. He is a major in the Rhode Island Air National Guard and spent time in Senegal assisting in during the Ebola outbreak. A Bronze Star Medal recipient for serving in Operations Iraqi Freedom, past president of the National Association of County and City Health Officials. He holds a doctorate in public health with emphasis in preventive care from the University of Kentucky, a Master's of Science degree from the University of Tennessee in Bioscience Engineering, and a Bachelor's of Science degree from Tennessee State University. Thank you, Dr. Jett, for being with us as well. And next we have one of our very own, Realtor Geoff Brewer. Geoff is a highly respected realtor and broker with over 16 years of experience in the business. He is a graduate in business marketing from the University of Kentucky. He's a team owner of Team Brewer and a business owner of United Real Estate Music City, and a songwriter as well. I don't know if Geoff is going to sing for us today or not, but a songwriter and singer as well. With the Commonwealth Band, that's the name of the group. We're grateful for Geoff to be here to share his story of this pandemic and his journey with COVID-19, and to give us whatever advice he can to help us prevent, if possible, the road that he's been traveling since contacting the coronavirus. Thank you so much for being with us, Geoff. Also on the call is our CEO, Steve Stevens. And with that, I turn it over to our chairman, Lamont Breland.
Thank you, Mr. President, and thank you to each of our guests for taking time out of your busy schedule. And Dr. Jett and Rachel, thank you for your service, standing in the gap, trying to help us all get better. So thank you all. Kentucky Realtors, welcome. Remember, we have a chat room open. You can have any questions. Please be sure to type those in there, and we will make sure that the questions get answered. So I want to start off, it seems like for months now, kind of the office talk is, gosh, do you know anybody that's gotten COVID yet? No, I haven't heard of anybody. But that's changing now. It seems like we're all starting to know of folks that have contracted the virus or been around others that have. So Geoff Brewer is one who has actually been there. And like Lester said, he's a busy realtor. He's built a lot of homes and multifamily properties. He's been in the business a long time, over 15 years. So Geoff, tell us a little bit about your journey and anything you might want to share with us. And I know you're struggling a little bit with coughing and so forth, because you're not out of the woods yet, doesn't sound like.
Yeah. Well, I appreciate you guys for having me on here. And, when Greg called me, I was more than willing to, do this and, try to help spread, as much knowledge that I've gained over the last 27 days about this. And I can tell you it's not easy. It was Friday morning, the 3rd of July. I woke up and I kind of had an itchy throat, and so I took some Zyrtec, just thinking it was allergies or whatever. And by that night at about 7 o'clock, I was trying to put an offer to purchase together, and I was so sick that I couldn't even get through on dot loop to put it together. I didn't get out of bed on the 4th of July or Sunday, and by Monday evening, I'd got to the point where I couldn't breathe at all. So I asked my wife to take me to the emergency room. I got there, had a temperature of 103. Oxygen level had dropped down to about 88 at that point. And so they admitted me in the hospital. I spent 11 days at University of Kentucky Hospital, and they ended up doing the treatment with Remdesivir. And they didn't do that treatment until I was probably there about 3 or 4 days. Because they said I guess there's certain criteria that you have to meet for them to be able to start you on that drug. So they kept, they did blood work each day. I had a temperature of 103 for about 7 straight days. It was not fun. I experienced getting a body rash basically from head to toe. It kind of felt like I had poison oak. Extreme migraine. I had a migraine for probably about 4 days straight while I was in there. Nothing really seemed to help that. My oxygen levels run anywhere from I never really dropped I think below 84, 85. But I was on oxygen for several days, and I got out. I was there 11 days. I got out of the hospital on the 17th, and luckily got to come home. But honestly, since I've been home, the biggest thing is fatigue, shortness of breath. I feel like I have an elephant sitting on my chest still. If I walk room to room, I break out in a cold sweat. I have to lay down. Like we were talking earlier, yesterday I wanted to just do something to have a little bit of sense of normalcy. And my wife and I took her right out into the country to a house we purchased. And by the time I got back, I was so tired that I could barely stand up. And I've kind of felt that way all day today. I haven't done a lot, and I'm trying to do some breathing treatments. They sent me home. I'm sure Rachel or Dr. Jett can tell you what the little machine is. I'm trying to do breathing treatments on that. and I'm doing an inhaler about every 4 hours. But it's I'm pretty tough. I don't go to the doctor a lot, and I don't think I've ever, 43 years old, and I've never been this sick in my life. And the thing is, in my mind, I want to do stuff, and I'm not. When you're not able to walk room to room, it gets pretty frustrating, to be honest with you. It definitely takes a mental toll on you as much as it does a physical toll. But
So where were you on the spectrum, say of 1 to 10, before this, with regard to taking precautions, PPE, that type of thing?
I've actually been pretty cautious. I was wearing masks. Still meeting clients that had to meet. I did a lot of virtual showings with clients. I sold 3 houses virtually. After this started, but used hand sanitizer every single time I went out, touched stuff, wore a mask every time I was in public with people. And, my wife and both of my kids got sick as well. My kids, it was a totally different experience for all 4 of us. My daughter was sick for probably about 3 days. She had probably one of those days she really, didn't feel like getting out of bed at all. My son, it hit the lightest. He kind of just had like a little bit of a cold. And then my wife, she was really sick for about 10 days, and she had about 3 days where she didn't get out of bed either. So it's been a totally different experience for all 4 of us. And, I am a type 1 diabetic. I got diagnosed with late onset of type 1, which is crazy, just this past year. So I was, trying to be overly precautious of just getting diagnosed with diabetes. And, with this, and we have no idea. Every single person that I was around that week, I called them and let them know. They all got tested, and they all tested negative. So as far as know where we picked up the virus, I have no idea.
Let me ask Rachel Alexander over at Norton Healthcare, how typical is this type of, I guess when you have multiple people with all different types of symptoms, that seems to be the scary part. What are you all seeing over at Norton Healthcare?
And we do see that. I mean, the scarier thing is the people that are asymptomatic and don't even have any symptoms. So we see symptoms vary from children to adults, people within the same household. So what he's describing, yes, is very, very, very similar to what we've seen throughout Norton.
And do we know yet, it sounds like he said 27, 28 days, and he's still obviously struggling. Is that, I guess that we just don't know enough yet. It affects everyone differently, it seems.
Well, and Dr. Jett can jump in as well, but I think that we've seen viral shedding 28 or more days. Him being a type 1 diabetic, that obviously is going to affect some things a little bit, probably. But, we've seen this affect everyone a little bit differently based on, your health history, among many other things.
Right. Dr. Jett, and thank you for being with us. You're out in Brookline, Massachusetts, but you have a history here in the Louisville metro area. What are your takeaways, and what are you seeing in your area?
Well, so first of all, thank you for having me. I'm always gracious enough to be invited to share experiences. I have a little bit of a different take because I've been quarantining people since January. And I started following, in Brookline, I have 18% of the population is Asian, and they travel back and forth. So I thought it was highly important immediately to begin to shut off people from traveling to the U.S. And I thought the next step was to require masks. So I was looking at prevention measures, such as other states have taken in Kentucky, requiring masks and requiring social distancing early. So I put in place requiring masks for the town, places that stayed open in early March. I required a mask for all residents. In fact, I was the first in the nation to apply Board of Health law and require masks of our residents April 15th. And because of that, Brookline cases have stayed at 500, whereas Boston now is close to 15,000 plus. and so is everybody surrounded. It was a 3 to 4 week lag before the rest of Massachusetts caught up. I actually contacted my friends in Kentucky that run the health department there, and different municipalities there, because I'm still friends, and said, you need to do this immediately, including Bullitt County and my friends in Louisville.
Mm-hmm.
But one of the things that I saw was people began to reopen too fast because the cases were low. But remember, we don't have a vaccine because the flu didn't require everybody to get a flu shot, because a large part of the population did, and we have herd immunity. So one of the things I would caution was in school, and I know Kentucky will be doing it as well as other states. If there's no way to do ventilation, social distance of 6 feet, and require masks, you're going to see us going back to phase 2 and phase 1 in some parts of the country.
You know, one of the things that I have observed as I go out into the state, in Louisville, it seems like we're doing a really good job of wearing masks in public and so forth. But as you go out a little further into the state, and you don't have to go very far, it seems like it's a little more lax. And I'm not sure why that is. Do we know if some of our cases are coming from out in the state more? And I don't know, that may be a question for Rachel, but that may be a little further out than you go, but any thoughts on that?
I think statistically, actually, the metro area has more cases, but that would make sense because we're more densely populated here. I couldn't tell you data about the surrounding counties as much. I will say that I feel like a lot of the restaurants, stores in the metro area do a really good job of posting signage, things like that out front. I live not far from Bullitt County, and we go in and out all the time, and I will say that I don't see that quite as much. And I don't know, you know, if it's just more small local businesses, and it might be, but you know, I don't know that we see an increase of numbers in those areas because they're not as densely populated as the metro.
Okay.
Yeah, so I can answer that question for you. What I have noticed in my travels, and I have been back to Kentucky, and I'm hoping that I can return for the Kentucky Derby. So I'm hoping everybody do the right thing.
Right.
But cities that are heavily populated, especially apartment buildings or public housing, because people are condensed and packed, you would see more cases. Mm-hmm. It's easily spread. What I've been seeing, especially in nursing homes, is the disease is passed not just through droplet form, but it's also aerosolized. And it was one of the reasons that I required a face mask in public at all times, because I anticipated and worked with Harvard, which is in Brookline, Harvard Medical School, is that the latest research is anything from 3 minutes to probably 9 hours that you would see the virus probably being in the air. So even if you take your mask off and you're walking outside, you know, and somebody just left that area, it's very possible that the pathogen could still be in the air at that time. Mm-hmm. When you move further out into, I would say, the rural parts of towns or communities, it's more spatial.
Right.
One of the things I can tell you, Brookline has a lot of mansions. If I put a family in a household in a mansion and actually tell a person to isolate their sick and a person that is not, quarantine them, because they have the spatial room to spread out, the disease doesn't transmit. But when they're in an apartment complex or they're in a 1-bedroom house or 2-bedroom, the disease spread faster.
Let me ask you this. Let's talk about testing for a minute. That seems to be the million-dollar question. Do we get tested? When do we get tested? How often do we get tested? How effective is, once you're tested, it only goes back, it only tells, I think, if you've been infected in the last 10 days or so. Any opinion from either of you professionals on testing and when we should and if we should?
I'll let Ms. Alexander answer first, and then I can chime in from there.
I was going to say I'll let you answer first, but sure. I think that we have seen a change in that from March, at least in our area, on what I would tell you when you asked me that question. In March, So I do telehealth. I'm sorry, I don't know that I've said that, but so everything I do interact with patients is virtual. So we have video visits similar to this where we're face-to-face, or we also have e-visits, which are a questionnaire. And so we call you and we talk through your questionnaire. So in March, when we were starting to see cases, honestly, we didn't have the testing capability here at that time, or it was very limited. And so we have a pretty large health system here, and it was still very limited. So at that point, it was treat the patients based on their symptoms. We're reserving our testing for those severely ill, hospitalized patients, or in those community settings, nursing homes, incarcerated, things like that. So for a while, probably a month solid, it was, I talked to you through video, we talked through your symptoms. If you weren't in any distress and I didn't feel like you needed to go to the hospital, it was, you know what, you need to stay home for 14 days and isolate your family as well. And that's just kind of where we were then, because our testing capability just wasn't what it is now. So fast forward, I would say maybe mid-May, testing became more available in our area. So when patients were symptomatic, now I'll say when you have symptoms, at that point when you had symptoms and we thought you were pretty likely to have COVID, we would send you for testing. Through telemedicine, what we worked out was we set up a freestanding drive-through testing center. So if I saw you via telehealth and I wanted to send you for a test, we have a drive-through testing center. You would go get your nasal swab. The results would come to me. At that point, we were out about 5 days for testing. So that process worked very well. For those who didn't have symptoms, we still didn't have that much capability for testing. So asymptomatic people in our area, in our health system, we tended not to test. Now that was different for first responders, healthcare workers. There was a whole carve out of people, but the general public, if you didn't have symptoms at that point, we really weren't testing. Fast forward to now, or even a few weeks ago, we basically opened up testing to anyone who was interested. So our drive-through testing center now, you don't have to have an order from a physician or nurse practitioner. You can just schedule and have a drive-through test. If you see one of our providers through telehealth, we still follow that process and send you to the drive-through testing center. What we're running into right now is our tests are out 7 to 10 days, 10 being the more common, which can be problematic. So when you ask if you should be tested, and Dr. Jett may have a different testing ability than us, but if you are asymptomatic, you are working from home, you are not around anyone that's immunocompromised, we don't really push a whole lot for asymptomatic testing right now. Just when our organization, we don't have the testing capability. The past 2 weeks, we haven't received testing supplies from government. They've been shipped to other hotspots in the nation, which we see in Arizona, other places like that. So now, obviously, if you're symptomatic, if you're a healthcare worker, if you're a first responder, if you have contact with someone in your household that's been ill, we see those positives. It's like 4 to 5 days from exposure is when we would start to see symptoms and see your test. But if you don't have any symptoms and you've not been exposed and you just go get a test, we're not exactly sure when did you have the exposure, or that asymptomatic testing right now, since we don't have a widespread ability to test and our supplies are limited and it's taking 10 or more days, we wouldn't necessarily recommend asymptomatic testing. Now, I say that as our health system, what we have right now, the governor or, other health departments might want as many people to be tested. And ideally, I would love as many people to be tested as they could. But just with our resources right now, we're not recommending that, unless you've had an exposure, you're in a high-risk occupation, or you are ill. And Dr. Jett, you all might follow a different process.
Dr. Jett, your thoughts?
Yeah, so thank you, Ms. Alexander. And so let me take a step back, because I think when you look at what has happened as a country, we really botched this. So one, the news media said asymptomatic people didn't need to wear masks, but they potentially could be a spreader, right? And they said, well, it's not 1%. It's a lot of asymptomatic people who could be spreading the disease. So if you look at that, number one, we started on the wrong premise. If you go back to the World Health Organization and China, they just did a joint mission. They tested about 56,000 people. 1% were asymptomatic. Kids 19 and younger, it was almost 1% of them actually had COVID. The highest age groups that had middle age, 51 years of age was the highest age of COVID, was the average. The highest death was in the 70s. That number has been applied to the US. South Korea, they decided to test everybody. So they found the people that were asymptomatic and the people that were symptomatic, they isolated and they quarantined everybody immediately, stopped the disease in its tracks. China, they shut down the country, grabbed everybody that didn't wear masks, which they have been doing for decades because of pollution. The US, we told everybody, if you're asymptomatic, don't wear a mask, don't worry about being tested. Now, you're starting to see it spread because there is a small subgroup of the population that are spreaders. So, and we didn't have enough tests available. What should occur from a public health standpoint is that everybody needs to get tested today. Find out everybody that's asymptomatic that possibly might be spreading the disease, and then find the people that are sick. We told everybody in the beginning that had mild symptoms, don't come to the hospital because the hospital don't have enough beds. Well, there you go. And we didn't test. So I used to list them as probable because they fit the clinical definition of having COVID. We just couldn't confirm it because we never gave them a test. Now these people are going back getting an antibody test. Voila, they had COVID. So what should happen is we should have 350 million tests available, send everybody right now to test, go door to door, stop the disease in its tracks, if we're not going to shut down the country overall. People that are thinking that they probably shouldn't get tested, if it was me, I would wait until probably about the 5th day if I had symptoms, and then go get a test. Test probably takes 3 days, hopefully to come back. Some jurisdictions, it's taking 10 days. If I go get a test, go to the home, stay in my home. Make sure I stay there for 14 days until I have fully recovered. Sometimes people are going to get 2 to 3 tests, and it's insignificant because some of the tests are good. One, they have gotten better over time, but number two, while you're going out to get multiple tests to make sure you get a confirmation, you are still spreading the disease.
Well, and you mentioned having the symptoms, both you and Rachel, and then Geoff also mentioned allergies. You know, here in the Ohio Valley, we are like ground zero for allergies. So I think everybody thinks they have COVID, whether they do or not, me included. And I think that probably jams up the system a little bit. But I'm not sure.
Well, I would agree. I actually have allergy problems now because I lived in Ohio Valley for almost 20 years. Every year I have allergies. I take Zyrtec every day. But it's easy to begin to distinguish when we begin to get fatigue, loss of sense, loss of smell, loss of taste. If for some reason you have breathing problems, and one of the things that people don't really talk about, if you start to really feel fatigue and you're at home, actually moving around in your home while you have COVID actually helps clear your lungs.
Someone had mentioned, there's a question over here regarding Geoff, in that his whole family got it. Is there any chance that he could have gotten it from his children who are asymptomatic?
I can answer that real fast. What I have seen, a lot of people, I wouldn't say a lot, I've seen a lot of cases where the adults actually got it from the kids. I actually closed down schools March 11th because we had a cluster in a school and the kids actually gave it to the adults. Even our state health commissioner that lives in Brookline, I'm tracking, didn't know where she initially got it, and then we tracked it back to her kids. They were in high school. So it's definitely, kids sometimes they play it off, don't think they really have symptoms, but they had one or two, and the adults seem to contract it that way.
Okay.
Well, as far as, our situation was, I was the first one that kind of showed symptoms of being sick. when I woke up that Friday morning. Like I said, I thought maybe it was just allergies. I took a Zyrtec. And then my daughter, she started showing symptoms. That was on Friday. She started showing symptoms on Sunday. My wife and son started showing symptoms on Monday. And I had actually kind of quarantined myself into the bedroom over the weekend. I really wasn't able to get out. You know, they were in the rest of the house. I'd put myself in the bedroom for the weekend. So I took my test on Saturday, and luckily I got my results back on Monday. But at that point, they had, we'd eaten together. We'd done a lot of things. And like I said, I don't know where we contracted it from. We're thinking maybe it was, from a fast food restaurant where we went through a drive-through and maybe picked up food, because every single person around us had tested negative. And, we'd worn masks and hand sanitized, and all of us, we've been very vigilant on, making sure to try to be as clean as possible and do the right things. And it's still, it's been a rough month.
Yeah, absolutely. Can you all expand on, so what the two different, I think there's two different tests. One is the antibody test and one is not. Can you explain the two tests and what they do? Not you, Geoff. You're a realtor.
Yeah, I don't know.
Dr. Jett, you want to take that one, or do you want? Completely up to you.
Yes, I want to make sure everybody can hear me well.
Yeah, I hear you. I think we're good.
Okay. So can you repeat the question, make sure I heard it clearly?
Yeah, so it seems like when people say, oh, I'm going to get tested, they'll say, oh, I'm getting the antibody test, or, oh, I'm getting the other test. So, are there two tests, and if so, what are the differences?
Well, so there's actually three types of tests. One of them is the nasal swab, one of them is the oral, which is actually testing for the infection of COVID. Okay. So that's the difference. The antibody test is testing to see if you actually had it or not and have recovered. Now, it's possible if the antibody test has IgG or IgM. IgG means you had it, you recovered. IgM means you're still infectious. So the antibody test could also, if it has both of those components, see if you're infectious at that point.
So does the test that tells if you had it, I hear things that say, but it only tells if you had it within the last 10 days. Or is it more historical from the beginning of time?
It could go back a little bit further because it's a finger prick and they actually looking at your blood.
Okay. Gotcha. Okay.
I'll chime in on that too. So as a health system, we were offered antibody testing. All the healthcare workers were. So I thought, sure, why not? Let's see. And so I had my blood drawn and I had positive antibodies. They found that less than 4% of our health system had antibodies, but I was never sick, never had symptoms. But then my husband's a first responder, and they had him go to do antibody testing, their whole platoon, and he didn't have antibodies. So I think there's just so many things. Either I'm very good at isolating, or, so it's just very interesting that both of us in the same household, one of us had antibodies, one of us didn't.
I think everybody for.
Yeah.
So I would just say, real quick, what has happened is some of the antibody tests have not been as accurate. There's been some false positives, as well as the regular COVID test. And sometimes you will hear people have contracted COVID twice. But what has actually happened is the immune system responded to the first attack, but they didn't have full-blown COVID. And then the next time they actually contract COVID, and that's the difference.
We have a question regarding some confusion on how this disease spreads. So it seems like one week you hear you can get it from touching surfaces. The next week they say, well, no, maybe not. Any thoughts on the top ways of spreading, other than wearing a mask and mist and all that? Any thoughts on that? And can you contract it, or do we know through surface touching?
Yeah, so, one, CDC put a lot of information at the beginning that people can contract it from surfaces, and they have had to walk that back because very few people have contracted anything from a surface. And it's the same with Ebola. So you know, this disease acts no different than H1N1, other SARS, you know, other things that have happened in the past. The same measures we've used in the past, we should use those going forward. You can over sanitize, but the only way you really can contract it is highly transmissible air droplet, aerosolized form. Wash your hands. So if you do touch a surface, wash your hands. Hopefully you got a mask on. Don't have to worry about that.
Okay. So anything to add on that, Rachel? Are you good with that?
Oh, yeah. And I saw the question about the drive-through testing center accuracy. So it depends on which test you get. Dr. Jett can probably talk more as to that. So as a health system, there are two main brands of tests that we use. They are all nasal pharyngeal swabs, and then they go out to a lab. And they're, like I said, taking 7 to 10 days to come back. There are some rapid tests available. Some urgent cares around the city do have those. Those take about 45 minutes from the time of swab. We choose to not use those because we've seen that they've not been as accurate. I think there are probably mixed opinions on that, but if you look at the sensitivity and specificity of a test, we tend to see those immediate or 45-minute tests don't have the sensitivity that we see the tests that we use have. So if you come through one of our testing centers, yes, we have a pretty accurate test. Some of those more rapid tests, we tend to not see those be as accurate.
Is there any truth to, I've heard it said that, you know, fast forward 6 months or a year, we've all been sanitizing 50 times a day, wearing masks, doing all this business, that our immune system is going to weaken. You know, there's nothing for it to fight during this period, and that we'll be able to pick up viruses easier going forward. Is that conspiracy theory, or is there any truth to that? Or am I just making that up?
So does the health policy guy want to talk on that, or me? I mean, I think sanitizing and masking, and I mean, I don't think you're going to see a decrease in your immune system. Actually, this fall, we're hoping we'll see less transmission of other viral illnesses too, if we continue the masking, the increased hand washing, the social distancing. Dr. Jett.
So, yeah. So as we kind of start to wrap up here, we're in the real estate business. We are out showing properties. We're in multiple. I showed 10 houses on Saturday. Had the glove, you know, didn't have gloves on, but always sanitized and had my mask on and all that business. What is, other than, I mean, I guess we just feel like we need to keep pounding it into our members, stay diligent, keep doing the things we're doing, but do them even better. Is there, I mean, is that the message? Because are there things that we can be doing maybe that we're not to keep our members safe? You know, we've got whatever we have, 20,000 members, 12,000 members out there, and to the general public. What is it? What's the one thing that we need to make sure that we do or continue to do, to both of you, all three of you?
Well, I would just say, you know, first and foremost, and I'm preaching this, and I live by public health. Even when I retire, I live by what I've learned as an epidemiologist and as a public health professional. So I believe this, and I carry this everywhere I go. The one thing I would say that might save your life, because I don't know if many of you saw, Herman Cain died today. And, you know, he was at a rally talking about not wearing masks. And, you know, there's a lot of people not believing in this, but I would guarantee you that it's probably the only reason that I have not contracted to this point is, you know, I'm very, very overprotective and wearing a mask and social distancing and trying to make smart decisions at all times. And I think, you know, I wish this was a sprint, but a vaccine may not come until November, December. I've been talking to Moderna, and you know, I do know that they're in the third phase. they should wrap up with doing 30,000 clinical trials by October, and it takes about a month for turnaround for the vaccine. So the clearest thing to me, the message that I want to drive home to everybody is wear a mask, practice social distancing, be safe, be smart, and you will live through this.
Good stuff. Anybody else want to add anything before I turn it back to Lester?
I've actually got a question for, Dr. Jett and Miss Alexandra. When I left the hospital, I asked them, should I go and get tested again? And they said, honestly, you can probably test positive for several months after you have this, even if the virus is dead in you. So, as far as I'm assuming, I think this is going to be my 14th or 15th day. And when I feel like it, I just want to know when I should feel safe enough to be able to get back or, get around my family, not my immediate family, but like my mom and people like that. Like, how long should I wait before I do something like that?
So the gold standard for public health is 3 days when you take no type of medication to reduce your fever, 10 days from the onset of disease. So when all your symptoms are gone, fatigue is going to be there for a while. I've seen
the
fatigue.
cough? The cough needs to be gone as well?
Yeah, the cough, usually I've had somebody in isolation almost 90 days, but that cough will linger for a while.
Yeah.
But after a certain period of time, it will no longer be infectious. So how many days since the onset? You said July 5th?
July 3rd.
July 3rd.
Yeah.
So
I haven't had a temperature in about 10 days now.
Yeah. So so now if you was to go get an antibody test, it'll probably show, slightly IgM, but a positive in IgG. So you're making a transition. Okay. So I would think after about another week, you'll probably be pretty good.
Okay. Thank you.
And just so you know, I do all the isolation and quarantine and release of patients in Brookline, regardless if they go to the hospital or whatever. The isolation quarantine is ran by the health department.
Thank you.
Good. Anybody else have anything?
I'll say one thing, if I can, Lamont and Lester. I just want to thank Geoff for coming on. I know it's been a struggle for you, and just let you know that not only the LBAR family is there for you to support you in anything you need, but I know we got some KYR folks that do the same thing. So just let us know if you need anything, Geoff. Thanks.
I really appreciate it. And like I said, I'm happy to try to spread as much education as I can of how it's, affected me. And, I don't like to get into political conversations, especially on social media. And, it's kind of unbelievable of the backlash. And, I've posted, what my experience has been, and people are crazy. I mean, I've had private messages of, telling me that I'm faking being sick. And I'm just like, okay, but it's crazy. And, I don't wish this on anyone. It's a terrible thing. It's hard to get over. And, but I appreciate that. And if I can do anything to help, spread the message, I'm here, Greg.
Yeah, I'd just like to say something to you as well. First of all, it is brave coming forward. I would just say, when I initially started to pass policies in Brookline, because I'm the Board of Health, and it was not very popular. I have Harvard, BU, 9 schools of public health. Brookline, 45% of the population has an MD and a PhD. So, everybody was an expert. And in the end, now they're thanking me for it, but it was to the point that I was going to quit and go hide somewhere for 6 months and just pray for people, because you will be taking on a lot of evil people.
There's a lot of scrutiny, yeah.
But I would just say, stay safe, protect your family, and educate as many people as you can, because a lot of people still don't believe it's real. And thank you.
Appreciate it.
Well, Geoff, hang in there, brother.
Hey, thank you all.
And Rachel, thank you for being with us. Keep up the good work you're doing. And Dr. Jett, thank you for dialing in all the way from Massachusetts. We appreciate you and your work. Lester, I'm going to hand it back to you, sir.
Okay, I have a question for Rachel. If I could, Rachel, what was it like at the very beginning, you all taking calls, and what kind of fears were you picking up from patients calling in and early on and even now?
So our telehealth service through middle of March into April, we probably saw about 5 times the patient volume that we had typically seen prior to that. Which, you know, you can look at that in a few ways. They really, as a health system, tried to push patients to telehealth if appropriate, because that was how we decreased spread of illness. We were the only service line within the organization that didn't have a provider, so nurse practitioner, physician exposure due to COVID, because we were obviously never in the same room as our patients. And you know, we dealt with not only symptoms, but anxiety, fear. People weren't able to work. They had their kids home with them. They were scared they were going to get sick or get a family member sick. So not only were we dealing with COVID concerns, but we were also dealing with the mental health impact and that, the economic impact of that. To say that that's improved, I would say maybe through June and July, we saw a little bit of improvement of that. But probably in the past 2 to 3 weeks, we're starting to see that upswing in volume again. And not just COVID symptoms, but just more the anxiety and the impact of, you know, this is again probably going to continue for quite a while until there's a vaccine. And so I think it's just taking its toll on people. So we're dealing with just not only their illness, but just all of their health concerns as well. I mean, if they don't feel that it's safe to go into the office to talk about their blood pressure medicine, or if they have a chronic care issue, then they'll try to see us. And what we've been able to do is, if you have a primary care physician in the system, we've been able to connect them with telehealth as well. So we still offer that as an option. Many patients have chosen to go back in the office. Honestly, I think we're going to see in the next few weeks that we're going to try to push more to telehealth again, which is probably wise. And so our volumes have still increased, and I think it will always remain that way. People have tried telehealth, they like it. It reduces barriers to traveling and transportation issues. So I think we'll see that volumes stay pretty steady, but we're also seeing some go back into the office, and a lot of the pediatric patients have gone back into the offices as well. But it has definitely been, you know, things change day by day. We work very closely with our collaborating physicians and all of our providers in our group, CDC, health department. We had daily meetings as far as a COVID task force of, this is what's going on in the system, this is what's going on in the hospital, so on and so forth. So definitely has been a very different experience the past 6 months.
Thank you so much. Thank you, Dr. Jett. Is there anything else you wanted to say before we start shutting down?
Well, I would just say one last thing. If people have opportunity to get a test, please do. I do know that there was tests going on at the convention center, the fairgrounds, and they shut it down because a lot of people didn't get tests. So I would advise people to continue to do it and do it often.
Thank you. And Geoff, again, just like it's been said for Greg and everyone else, we certainly appreciate you having the courage, because I do know that everyone would not do what you did coming on, because there early on there was such a stigma, and people didn't know what it really meant. So it took great courage for you to come forth and talk to your realtor family, and we're more than appreciative. If there's anything that we can do, let us know. So again, thanks everyone for being with us today, and thank you all for being the panelists that we truly appreciate the information that you've shared.
Thanks for having me. Be happy to help any way I can.
Thank you so much.